Hi, Sue McCarthy Robinson, and I want to cover an encounter experience that I had this week in MN662. So we have a very young girl, age 22, that I'm very familiar with, and she decided that she would attempt suicide this week. So I responded to the emergency. It was code blue, and it was pretty distressing and traumatic, to say the least. The initial reaction, was kind of shock, or because I didn't expect this of her. Speaking with her week after week, the sight was kind of overwhelming and deeply unsettling. But quickly, that surge of adrenaline, as nursing days, respiratory therapy days, kicked in. So rush to provide, emergency care, that kicked in to do what I needed to do to maintain an airway, and assist my team. So alongside that urgent response, there, no matter how many times you go through just a code blue, there's profound fear for that patient's survival and anxiety about the effectiveness of your emergency interventions. There was definitely some profound sadness, and, realizing that, it's sometimes hard to predict. And, I didn't really see it coming. She seemed to be in pretty good spirits the week prior, and, up until that day, just asking the team, how she was acting. And it's just kind of something that we were all kind of surprised with. So it is kind of a sense of helplessness set in, during that time, especially when I thought that could there have been something that I could have done to prevent this attempt. She survived, so that's a positive thing. So, kind of led me down a road of like some guilt and questioning whether, did I miss those warning signs? So kind of was frustrated with myself, challenge with, did we provide her the adequate mental health care that she needed? So despite those emotions and deep sense of compassion and empathy towards her, and the pain and the struggles that was feeling, continue to support and advocate for her, sent her out to the hospital. She's now was sent back to us. So during this emotional turmoil, maintain a strong sense of professional responsibility, focused on, stabilizing that patient, following protocols, ensuring that all necessary steps were taken for her safety and well-being. After the immediate crisis, I mentioned I reflected, which led me down, that we all needed some emotional support and debriefing post the situation. So, talking it through and kind of having a team huddle and how we could prevent, or maybe, somehow, predicted that she wasn't acting right. Did anyone see anything? Just kind of talking that through so we can, if at all, prevent something like this from happening again. So the second thing is discuss the impact this had on the terms of increasing your understanding is that psych nurse practitioner role and the psychopathology and the provider-patient relationship. Finding a patient that, obviously attempted suicide deepened my appreciation for the complexities of that psych nurse practitioner role, the profound nature of that psychopathology, and the intricate dynamics of that provider-patient relationship. Underscored the need for preparedness, empathy, continuous learning, and self-care in the field of psychiatric mental health nursing. Exploring the personal strengths and limitations. My personal strengths, such as empathy, strong communication skills, resilience, positively influence that provider-patient relation by fostering trust and understanding. Empathy allows me to connect deeply with patients, making them feel heard and supported. Effective communication helps in clearly conveying treatment plans and listening to the patient concerns, enhancing their engagement in their care. Resilience ensures that I can handle the emotional demands of the job, However, my limitations, such as occasionally experiencing emotional overwhelming feelings and tendency to overextend myself, can impact my ability to remain fully present and attentive, potentially affecting the quality of patient interactions and care. So include reflection on my therapeutic use of self. So reflecting on my therapeutic use of self, I recognize how my genuine empathy and active listening create a safe and supportive environment for patients by sharing appropriate personal experiences and demonstrating compassion, kind of showing the vulnerable side. I build trust and rapport, which are crucial for that effective therapeutic relationships. However, I also acknowledge the need to maintain professional boundaries and manage my own emotional responses to avoid burnout. Balancing openness with professional detachment ensures that my support remains effective and sustainable. This self-awareness allows me to continuously refine my approach, ensuring that my presence remains a therapeutic tool that promotes healing and recovery for my patients. So my discussion should reflect specific learning and insight. So reflecting on my therapeutic use of self, I learned the importance of balancing empathy with professional boundaries. As I mentioned, my ability to connect deeply with the patients fosters trust, but I must manage my emotional responses to prevent that burnout, as I mentioned. This insight has taught me to refine my approach, ensuring that my empathy remains a therapeutic tool while maintaining self-care. This balance enhances my effectiveness, promoting patient healing while sustaining my ability to provide compassionate care. So identify something specific that I learned from reflecting on this event interaction, and how will I apply that learning in future practice. So, definitely reflecting on this event that has really stayed with me several days. I learned the critical importance of self-care, maintaining my effectiveness as a caregiver, by recognizing the need to manage my emotional responses and seek support when necessary. I can prevent that burnout and continue to provide high quality care in my future. Practice prioritize that self-care, regularly engage in debriefing sessions to process those traumatic experiences, ensuring that I remain silent and empathetic and supporting my patients. And, taking the time that I need to kind of process what happened is very important. And, using that mindfulness, um, and forgiveness that, I mentioned before, that could there have been something that I missed? Maybe there was, but, I need to forgive myself for that. She's okay. And, you know, we did what we needed to do. We're responsible, maintain professionalism, and learn from every experience that I go through. Thank you.